So here in California, we are opening in really, really fast pace. And I believe the 16th, I say even starting now this weekend, there has been a lot more people out shopping. There's been a lot more people at outdoor and indoor dining. And there's a lot of more activity that weren't happening during the lockdowns. And everybody's excited, or most people, for that. The fact that a lot more businesses will be opened again. However, even with this, what they call a grand opening, be aware that the pandemic is not really over officially, and it really will never be completely over. So, why I'm saying that is because there were cases of people that were getting sick even faster with the new variants that are out. And I hate to sound like the bearer of bad news, but the variants are actually even worse than the first initial outbreaks of COVID 19. And what has happened in China, the latest outbreak, doctors say the infected, they get sick faster. And from what I was reading, some people can have had the vaccine one dose or even two doses and still end up getting really, really ill. And so that doesn't sound very well, I know, especially with people being excited about some things going back to somewhat normal. But that's an illusion that's created because a lot of people were really struggling, businesses were struggling, and people were losing their businesses, and some businesses just closed altogether. They couldn't hang on to what was going on, and they just really couldn't hang in there with all of the lockdowns, and they weren't making the money that they would make had there not have been the lockdown. So some people suffered great losses. And speaking of those losses, not only losses of business, but there was a lot of loss of life. And it's not looking really too good for the near future. And I have to be honest about that. I don't think it would be in the best service of saying, oh, everything is great, everything is totally normal, we have nothing to really worry about. But according to what's going on, there are still some states and countries that are really battling, I would say, the variant version. And this variant version that I'm hearing, the name of it is called the Delta version of this COVID. So you see the title here. It says China's latest outbreak. Doctors say the infected, they get sick faster. And so this article is really long. Well, really not that long. But this video is going to be somewhat at length because I'm not going to only talk about the variant, but I'm going to talk about even California, some of the things that have happened, that I witnessed. And it's pretty sad. And some things have come out of it that might have been, like, oh, well, good and then not so good. But as you see here, pictured here, there are people that more than likely they have been infected with the variant, and it isn't a good look. But it's a vaccination center in Wuhan, China. On Wednesday, the doctors say in the country, they say the patients are sick with what is called the Delta variant, and they become more sicker then and their condition it worsens a lot faster than they did with the initial version of COVID-19. So this is by Keith Bradshaw. So as the Delta variant of the coronavirus spreads in the southeastern of China, doctors say that they're finding symptoms that are different and more dangerous than those that they saw in the initial version of the virus that started in 2019 in the central city of Wuhan. So patients are becoming sicker, their conditions are worsening much more quickly, and doctors told that the state-run television Thursday and Friday this was reported, and so 4/5 of the symptomatic cases developed fevers, and they said although it was not clear how that compared with earlier cases, and so the virus concentrations that are detected in the bodies, they climb to levels higher than previously seen, and then decline only very slowly, the doctors say. So up to about 12% of the patients become severely or critically ill within 3 to 4 days of the onset of these symptoms. And so this is by a Dr. Guan, the director of a critical care medicine at the Sun Yat-sen University in the city of Ganzhou, where the outbreak has been centered. So in the past, the proportion had been 2%, 3%, although occasionally up to about 10%, he said. So doctors in Britain and Brazil also have reported similar trends with the variants that circulated in those countries. But severity of these variants has not yet been confirmed. So the testimonies of China are the latest indication of the dangers posed by this Delta variant, which the World Health Organization last month labeled the variant of a concern. So first identified this spring in India, where it was blamed for widespread suffering and death. Delta has since become the dominant variant in Britain, where doctors suggest that it is more contagious and may infect. Now, listen to this. Some people who have already received 1 or 2 doses of the COVID vaccine. And so that's how dangerous this variant is. So China has uniquely detailed the data, however, on this Delta variant because it has initially universal testing in the vicinity of outbreaks, allowing officials to gather detailed information on the extent of cases. So Delta's spread in the southern eastern China focuses more attention on the effectiveness um, of China's self-made vaccines. So Chinese authorities have not indicated how many of the new infections have occurred in people who had been vaccinated. So in some other countries where Chinese-made vaccines are in wide use now, so including Seychelles and Mongolia, infections among vaccinated people are rising, although few patients have reportedly developed serious illness. And so even here in California and even outside of California in the US, if you have been vaccinated with a vaccine, you still are vulnerable to catching this disease, this virus. That is. So it doesn't shield you from catching it. It's supposed to make the situation less grave so that you won't end up in the hospital. And so there was a lot of reassuring, a lot of the, people who were, I would say, representative of hospitals and, medical staff did a lot of forewarning, and they also did a lot of representation of the vaccine to try to persuade more people to get the shots. And so now that they have more people that have been vaccinated, we still have people who haven't gotten any shots, and they have their own personal beliefs. And so what was told here in California is that those people who didn't get vaccinated versus the ones who got vaccinated, it it's more than likely that they will help drive the spread of the variants or whatever other diseases are out there having in regard to this virus having to do with it. And so that makes it problematic, which would reverse all of the efforts that they made to try to bring it to, I believe they were looking towards 70% of people being vaccinated um, in some multiple states. And so some people may not have gotten the shots and they may don't believe that they should get them. And so we have some issues here, some really great issues that are going on. And so with what's going on in China, by them battling this new what variant called the Delta, it's more than likely that some of these other variants will make their way here. We just don't know when, and I'm sure we'll see now that they're going to try to reopen things fully, because we already have situations where people are refusing to wear masks. They're refusing to do some of the, you know, minor things to stay safe and keep others safe. And so I will say this, I don't believe that this pandemic is over and will be over, because we have people who have their own intentions on what they feel, and some people have their own personal beliefs, and so that's what drives this thing even more. So nearby Shenzhen had a handful of cases last week of the alpha variant, is what they call it, which emerged in Britain. Going back to this article, so as some in some other parts of the world, they still struggle to acquire and administer large numbers of the test even. And so southeastern China has used its local production of scarce chemicals to conduct testing on a remarkable scale. Um, Authorities said that they had conducted 32 million tests in Gansu, which had 18 million people and 10 million people in adjacent cities of Fashion, which has 7 million. And so Gansu has also isolated and quarantined tens of thousands of residents who have been anywhere who had been anywhere near those infected. And so the testing and quarantine appear to have slowed but not stopped the outbreak at all. And so they're doing the same things that were originally done in the beginning, where they try to alert people and they try to go through their necessary protocols to keep people safe, but these things are not working. And so China's National Health Commission announced Friday that 9 new cases had been found in Gansu the previous day. And so the epidemic is not over yet, and the risk of the virus transmission is still exists. Was said by a Chen Bin, deputy director of Gansu Municipal Health Commission. And so that's that article. That article was not long at all. Basically, it's sort of like a forewarning to people who are really paying attention to what is going on. I feel like the reason why they're doing this reopening is because we suffered such great loss with businesses closing and then people losing their jobs. And here in California, a lot of people, you have still some that are out of work, some that are looking for a little bit of here and there so they can keep a roof over their head. I've seen a lot of people who have been evicted. I have seen it. And I'm not saying these are people who they just were slackers. I know we have some of that going on, but these were people who they, by no fault of their own, because of this pandemic, their jobs closed and they lost jobs, or either their job never came back, or by the time their job did come back, they were so far behind in rent, it was too late to catch it up. So to get to the point, even though they claim that there was rent relief programs, the money just sits there. And what had been slowing these programs down is that they were taking people through a series of questions, getting them to prove that they need the money in the first place. And it by doing that to thousands and maybe even more than thousands, maybe, you know, it could be in the millions, who knows, of people in similar circumstances. And I'm just throwing that out there. I don't know if it's millions, but it could be somewhere close to it. I'm hearing even in other cities where earlier in the pandemic there were people that were protected by a moratorium, and the moratorium is supposed to end this month here in California. Um, I even read somewhere where they said they were trying to extend the moratorium a little bit longer to try to keep people in their house or their apartment because of the problems with the rent relief moving so slow and dispersing money slowly. And that was the initial reason why they wanted to extend it a little longer. I don't know how much longer. I don't know if that actually is going to be the case, but they've been in talks to see if that could happen. But that also would be a problem for landlords, small landlords. And so, what I've heard about the landlords is that some of them never saw any money, no checks coming to them from the rent relief programs, that they also were stalled, and they had applied. The ones that were willing to help their tenants, they had applied along with the tenants, but they never seen anything indicating that they were going to receive any money to cover the back rents. And so all of that is moved so slowly that it has put people in positions where they're forced out of their apartment, or they end up worrying about the problem of foreclosure. And the housing industry hasn't really said anything. They've been quiet on the issue. And a lot of these landlords, they have lawyers. And you have some tenants that have lawyers, but there's more landlords with lawyers than the tenants. And we know how that goes. And so that's the unfortunate with all of this outbreak not really being at bay. We have a grand opening coming up where they're going to be opening up beaches. Okay, and so that brings another problem. We have homeless people on beaches, and so that's another issue right there. And so, with all of this going on, if we have that variant that does somehow make its way, if it hasn't already, make its way out here, hospitals could go back into the situation where they're filling up again. I did hear something about the numbers were ticking up slowly, not as fast as before, but I would believe that that information is being controlled because of this grand reopening. Because people for a whole year or more have been burned out by this coronavirus and pandemic stuff. But what's going to happen is it's going to be so hard to control because people's mindset is we want things open. It's probably going to be a lot more deadlier because people are going to be so resistant on closing anything or protecting themselves, and it's going to get chaotic. And so who knows, we will see. But hospitals are requiring their staff to get vaccinated, and if they don't, they have to work somewhere else. That is another issue that has come up. So about the homeless thing, homelessness is so bad that it has taken over our lovely beaches, which we're facing summer, and a lot of people like to go to the beach, and I'm afraid the beach is not what it used to be. They're trying to get it back like that because of this grand reopening, but homelessness has pretty much taken over the beach. And so Venice groups condemned Sheriff Villanueva's actions towards homeless. So they have been trying to sweep the homeless away, basically. So the groups added that the homelessness crisis has been caused by decades of disinvestment in affordable housing and other critical resources, systemic racism, and land use policies. So, housing, employment, and mass incarceration policies, and growing income and wealth inequality. So, all these things that we're experiencing, and now to add with that in the pot, we also have um, the issue of this pandemic. And what has happened is you have new homeless people. They may not necessarily be on the beach, but you're going to have more motels and hotels overrun with pandemic families. Let's put it that way. So, Sheriff Deputy Matson of a homeless outreach service team encouraged Renee Reyes, 28, on Tuesday, June 8, 2021, to leave the homeless encampment along the Venice Boardwalk, where he has been living in the past 3 months after a divorce. And so Sheriff Villanueva vowed on Monday to clean up the homeless encampments by the 4th of July, because that's where people are going to go out and celebrate for the holiday and what have you. And then it's summer. It marks the first, celebration of the summer. But I've been hearing fireworks even before 4th of July. It seems like all through the year. But LA, several Venice organizations have criticized LA County Sheriff Department, saying it's calling for the forced displacement and criminalization of unhoused people on the boardwalk. So they can give them tickets, they can put them in jail for various reasons, and they basically force them off the beach now. And so this week, LA County Sheriff and others unfamiliar with the Venice area and its unhoused residents held press events on the Venice Boardwalk calling for the forced displacement and criminalization of unhoused people in order to clean up the boardwalk, according to the statement released Friday afternoon. Venice Family Clinic, Grassroots, Neighbors, Safe Place for Youth, Venice Black, Indigenous and People of Color Elders, Venice Community Housing, Venice Justice Committee. So time and time again, this approach has proven to fail in LA. And so the cause and harm to already dealing with crisis, trauma, and extreme lack of affordable housing across the region, and especially on the west side. So the groups added that the homelessness crisis has been caused by decades of disinvestment in affordable housing and other critical resources, systemic racism and land use policies, housing, employment, mass incarceration policies, and growing income and wealth inequality. So he called for kindness towards the homeless, local outreach assets to medicine, and the investment in permanent housing solutions. So other collective communities will work to provide emergency services, secure, preserve, build more housing, and stand in solidarity to protect the rights of the unhoused folks. And hope that anyone interested in helping alleviate homelessness in Venice and beyond joins the efforts of the human-centered social justice framework, the statement has said. So Council Mike Bonin, who represents the neighborhood of the LA City Council, also criticized Sheriff's Department efforts to meet with homeless people around Oceanfront Walk in Venice, outside the sheriff's jurisdiction. So, and clear an encampment, calling the deputy's presence disruptive and counterproductive. So Bonin on Thursday tweeted that Sheriff Villanueva should leave outreach and housing to the professionals. So it's harmful to strut in and interfere with the work of the service providers who are trying to house people quietly, diligently, and in good faith. So Villanueva, who described the department's work in Venice as a humanitarian mission, told reporters on Monday that deputies will talk to people residing in the encampment at the beach to determine what they are doing to move from being homeless to having a place to stay. So he said that the homeless crisis in LA City limits prompts or prompted him or city limits have prompted him to take these actions. And so he also accused Bonin and the mayor Eric Garcetti of hampering the LA Police Department in its ability to do its job with regard to these encampments. And so that's pretty much what's been going on. There's more to it. So I'm not going to blame LAPD whatsoever, Villanueva said. But I think they can definitely do the job, and they're more than capable of having good leadership. So, however, if they're hamstrung by politicians that don't want them to do their job, well, then they're left in a very, very bad situation. So he visited the Venice encampment this week to view the failures of local politicians in regard to the homeless crisis, he said. And so this homeless issue has also been blamed on Gavin Newsom because he had vowed that he was going to try to resolve a lot of these issues. But it's only gotten worse, and some of this has gotten more worse or made more worse by the pandemic. It was already bad, and it was growing because of what they basically quoted up there about the disinvestment in housing, and then the systemic racism, the lack of employment, and high rates of incarceration. And so a lot of that is true. A lot of that has put people on the street and made it hard for people to just live. So he visited these encampments, and so he said that, adding that the agency's homeless outreach services team would be dispatched to the beach on Tuesday, assessing Venice, in order to triage the crises and develop an action plan to compassionately offer services while employing common sense in the regulation of public space within Los Angeles County. So he told reporters that he would like to see the Venice Beach encampment cleared by the 4th of July on holiday time. So this is when they're, you know, by then a lot of places will supposedly, here in California, we're supposed to reopen either June 15th or June 16th, anywhere in between there. I really feel like it's already started. This is the 13th of Sunday, and I feel like the grand reopening has already started because I've seen a lot of people out today, including myself, but I have to be honest. But I was wearing a mask. I have to say that. But what good that's going to do? There's so many people, and I feel like people were just really burned out from the pandemic alone. So the other thing that I thought was of issue is how the hospitals are looking at their staff, and they want their staff to have shots. If their staff does not have shots, they will have to look for somewhere else to go. So it's not my words, their words, guys. So it says court upholds Houston's hospital mandatory COVID-19 vaccine policy. Workers can refuse the vaccine. So you have the right to refuse the vaccine, but you'll simply need to work somewhere else. So basically, a lot of people will end up losing their jobs solely on that. So this is by Andrew Keshner. So a Texas hospital system's mandatory COVID-19 vaccine policy for employees can stand after a federal judge on Saturday dismissed a closely watched lawsuit from workers refusing to get shots. And so this is an issue, and that's not the only issue that's out there. I've been hearing the shootings are going up. People who were released during the pandemic from jails, that's gone back up again. They were trying to reduce the overcrowding in jails and release people who are low offenders. And that has shot back up again, the numbers of people going back to jail. Um, there's been a lot of shootings here in LA and California. There's been fights over mask wearing, either people wearing a mask or not wearing a mask. There's been some melees over that. So this pandemic and the dilemmas that go along with it we're far from over that. It is we're nowhere near over that yet, is what I'm saying. It is just beginning, actually, is what I'm saying. So it is that's a crisis as well, along with the crisis, many crises that we're dealing with. So the court upholds Houston's hospital mandatory COVID-19 vaccine policy. Workers can refuse this vaccine, but they will simply need to work somewhere else. And so that is true. And so I'm just showing you that this was last updated June 13th as we speak. So it's as of today. The case was the first of several lawsuits on mandatory workplace vaccination moving to resolute, observers say. And so this is the issue. So a Texas hospital's systems mandatory COVID vaccine 19 vaccine policy for employees can stand after the federal judge on Saturday dismissed a closely watched lawsuit from workers refusing to get shots. So, Southern District of Judge, the Texas judge, Len Hughes, made his decision days after Houston Methodist Hospital suspended 178 workers for not getting vaccinated by June the 7th deadline. So, the hospital system's policies were in coercion against staff, Hughes said. So they were a choice the hospital system made to keep staff, patients, and their families safer. And so 117 people are suing out of that 178 that were suspended. And so including plaintiff Jennifer Bridges, a nurse for almost 7 years at this hospital system, who had her own choice to make. The judge said, and Bridges and the other plaintiffs had every right to accept or refuse the vaccine. So if she refuses, she will simply need to work elsewhere. That is what the decision states. And so Hughes wrote that the employers could impose consequences or non-compliance on all sorts of rules far beyond the vaccination. So if the worker refuses an assignment, changed office, earlier start time, or other directive, he may be properly fired. So every employment includes limits on the worker's behavior in exchange for his remuneration. And so that is all part of the bargain. And so suspended workers could be fired if they are not vaccinated following a 2-week unpaid suspension. And that was said by the court papers filed ahead of this ruling. So Houston Methodist said it was pleased and reassured that by the judge's ruling, we can now put this behind us, so they say, and continue our focus on unparalleled safety, quality, service, and innovation. So this is by Dr. Mark Boone, the president CEO of the hospital system with approximately 26,000 employees, said in the statement. But Jared Woodfill, the lawyer for the suing workers, vowed to appeal this case. So he wants to take it back to court, all the way up to the Supreme Court. So this is going to be a fight that we're going to see. It may even be televised. I'm sure it will. I've seen some clips of it, and I think I might have seen the woman there referring to Jennifer, who she's a nurse, 17 years. She said that she does not want to receive this vaccine. And she's not alone. There's been others. And so they may have a particular belief or stance on it. And so I remember hearing a woman saying it wasn't FDA approved, blah, 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 blah. And she went in the whole nine with it. And so earlier on, before I got to this article, remember what I was telling you, that even people with 1 or 2 doses of the vaccines from where they are, these variants that are floating around right now making people even more sick faster, it has some type of way where it can get through those. Even if you got the shots, it can get through your vaccination. Somehow it has mutated to a higher strength where it is able to get in, still get people infected and get them very sick. So maybe that is one of the reasons why. But a lot of people that I've heard also have said, well, the vaccination may give you a line of defense. I've also heard they're trying to work on booster shots because they don't know how long these vaccinations that they've done to people, how long the immunity will last. I've heard 6 months. I've heard people say if you already got COVID and then you got the shot, it may be longer that you're immune. But from what I'm hearing, these variants, it may not be the case. It may be a whole nother animal altogether that we're dealing with. So through the lawsuit, okay, so let me go back to where it was. Houston Methodist is forcing its employees to be human guinea pigs as a condition for the continued employment, the lawsuit alleged. Hughes singled out the human guinea pig phrase and said that the workers' lawsuit was written in a press release style. And so, through the lawsuit, devoted most of it that this lawsuit devoted most of its attention to the argument that COVID-19 vaccinations were allegedly experimental and dangerous. The judge said that the claim was false, so it is also irrelevant to the litigation. And so, the hospital has defended its policy, saying mandatory employee vaccinations was critical to patient and worker safety. So the policy included exemptions on religious and medical grounds. So what they're saying is there's exemptions if you're from a religious group or you have medical issues that prove that you have medical conditions that you can't get the shot, or you're from a certain religious group, then they won't. You could still keep your job. Now, people who are just refusing the shot because they just don't want to take it, they're going to lose their job. I know it sounds kind of messed up, but that's what it's saying, not me. That's what they're saying. So the suing workers noted that the Pfizer and the BioNTech vaccines are, as well as the Moderna Johnson & Johnson vaccines, are publicly available because of the Food and Drug Administration granted emergency use authorization to these drugs. And so, in the eyes of the workers, the statute of the type of FDA authorization said workers had the right to refuse taking the vaccine. So the workers had it wrong because those particular provisions didn't give them an opening to sue. So Hughes said. So besides, Hughes noted that the Equal Opportunity Employee Commission has said employers can require vaccination. So this fight, I'm going to warn you, could possibly spread to other employment agencies, even here in California, where they don't quite require people to get vaccinated, but I'm sure that we'll hear some of this going on out here and in other places, in other states, other hospitals, other places of business who are really requiring people to get vaccinated. And so those people who think they went back to work and they're all excited might not have a job if they refuse to get the shot. And if they don't fit in the criterion for having a religious belief or a medical condition, then they could, they either would have to get that shot, those two shots, or they would have to just forfeit their job altogether, or look elsewhere for a job. So on the 4th of June, Hughes said that he would not block Houston Methodist from imposing a June 7th deadline for the vaccination. So they had a June 7th deadline. So in the decision at the time, Hughes wrote to the plaintiffs that were not jeopardizing their own health. They are jeopardizing the health of doctors, nurses, support staff, patients, and their families as well. And so that's how that article ended. And so right now, that is a huge fight going on. And I don't believe it's just going to be just only with this one hospital. I think it's going to spread to other hospitals, maybe other places of business. You're going to hear similar stories. They probably haven't come out and spoke out on the issues, but I believe it's coming if it hasn't already. So that's pretty much how this is going. They're excited about this grand reopening, but it isn't really going well for a lot of people right now. Yeah, it's opening, but too little too late. And so that's pretty much how I want to say that this is. It's opening too little, too late. And so this is one hell of a video, but I'm just basically laying out some of the issues that could possibly lie ahead. Is that we could end up having to battle these variants. We could see more of these issues and people in court behind all of these things that are pandemic related. So the pandemic is not over yet. Thanks for listening.